Hello, and thank you for joining us for the Center for Environmental Health's webinar on eliminating toxic chemicals in the childcare setting. My name is Alvaro Casanova, and I am the pollution prevention advocate. My colleague and co-presenter is Isa Gaillard, and he is the Environmental Justice Fellow here at CEH. We are pleased to have you join us for this webinar as your role in working with children places you in a great position to improve children's health. The Center for Environmental Health is a nonprofit organization committed to protecting the health of all people. We work with parents, communities, businesses, workers, and government agencies to protect children and families from toxic chemicals in our homes, workplaces, schools, and neighborhoods. Our webinar will cover a variety of chemicals and the products they are found in, but we hope that you will leave this training with a better understanding of the harmful effects of a number of chemicals on people, and especially children. We will also share ways to reduce human exposure to these chemicals and how to identify safer products. Our goal is that by the end of the workshop, you will be more informed early child care educator and be able to make healthier choices for you and the children in your care. When we share the health effects that have been linked to chemicals of concern, our partners are often shocked and they ask questions like, how did this happen? Aren't there laws that protect us from dangerous chemicals? So before we discuss the facts about specific chemicals of concern, we'd like to let you in on a little known fact. Chemicals are poorly regulated in this country, and harmful ones are frequently finding their ways into the products that families use every day. Most people assume that if a chemical is on the market, that someone has checked to make sure that it is safe. This is unfortunately not the case. There are over 82,000 chemicals in commerce, and 62,000 of them were grandfathered in 1976. So no health data was ever received for these chemicals. Of the new chemicals that have come into the market since the Toxic Substance Control Act was first passed, 85% have lacked the health data to assess the safety of the chemical, and 2/3 have no data on health or environmental impacts. Under the current law, the burden of proof is on the EPA to show that a chemical may be harmful, and most often the agency has no data to assess safety. The EPA has only been able to ban or regulate 5 chemicals since its beginning, and is so weak they cannot even ban asbestos. After 40 years, this law has been updated, but despite extensive efforts by environmental and health organizations, it will still have major shortcomings and will not adequately protect our health or the environment. The chemicals we will talk about today have a number of things in common that make them a problem for humans and the environment. Many of these chemicals are persistent, which means they last in the environment and do not break down for very long periods of time. Many are bioaccumulative, which means they become more concentrated as they move up the food chain. And who eats from the top of the food chain? Humans, especially nursing infants. Toxic means they are harmful to our health. Many of these chemicals we're going to talk about are linked to some common health concerns. Some are known or suspected to cause cancer. Others are mutagens, which means they can change our DNA, and others are associated with reproductive problems. In order to understand how we are impacted by toxic chemicals, we need to understand how chemicals get into our bodies. There are 3 primary ways. One is skin absorption. This happens when our skin comes in direct contact with chemicals, or when our skin comes into contact with products that contain chemicals, including clothes that contain these chemicals, or when we come into contact with contaminated surfaces. The second is ingestion. We eat and drink chemicals in food and water that has been contaminated, and also when we put our hands in our mouths after having touched contaminated surfaces. And lastly, through inhalation, which is when we breathe in air that is contaminated by chemicals. Children are exposed in unique ways. For example, children frequently play on the floor close to contaminated surfaces and are continually putting things in their mouths. And because of this, it means they are regularly getting these chemicals into their bodies. While breastfeeding is still the best way to feed a baby, breast milk has been found to contain certain chemicals that are then passed on to the child. It has also been found that many chemicals cross the placenta and into the fetus. Children's brains and bodies are developing rapidly, and therefore more affected by exposure to toxic substances. Their small bodies consume more air, water, and food than adults on a pound-for-pound basis, so these chemicals are more concentrated in their bodies. Toddlers have been found to have 3 to 15 times higher levels of flame retardants in their bodies than their parents due to their frequent hand-to-mouth activity and small body size. Other vulnerable populations include pregnant women and workers who either make, install, or recycle products contaminated with these chemicals. Firefighters who are exposed to these toxic combustion byproducts of the chemicals while putting out fires have high levels of flame retardants and also experience very high rates of cancer. Another group heavily burdened by flame retardant exposure are the people and wildlife at the Arctic. Pollutants are carried by wind and ocean currents to the Arctic, where these chemicals collect and accumulate in the fish, wildlife, and people, even though they are very far away from the industrial sources of these chemicals. Now I'll hand it over to Isa.
Thank you, Alvaro. So now that we have a basic understanding of how chemicals get into our bodies and some ways children are uniquely exposed, let's go deeper into the 4 chemicals of concern that are the focus of this webinar. We will start with flame retardants. Flame retardants are chemicals added to consumer products that are designed to slow and inhibit the spread of fire. What is of concern is that government studies have shown that flame retardant chemicals used in furniture do not actually provide added fire safety benefit, and the state of California exempted 20 children's products from having to meet any flammability standard because they determined these children's products did not pose a fire risk. Instead, these chemicals migrate out of the products over time and get into the air and concentrate in dust particles in our homes, offices, and child care centers. Virtually all people tested have detectable levels of flame retardants in their bodies. In 2012, the Chicago Tribune did an amazing investigative report on the lies and deceptions of the flame retardant industry, the lack of fire safety benefit provided, and the chemical industry's repeated use of a series of toxic chemicals. If you want to learn more about how these chemicals came to be in our furniture and in our bodies, we recommend reading the Tribune series, Playing with Fire. Children in California and children from low-income communities and communities of color have the highest levels of flame retardant chemicals in their bodies. In Graph A, you can see that children in California have the highest recorded levels of certain types of flame retardants called PBDEs, and much higher concentration of these flame retardants than typical adults. The only group found to have higher levels of flame retardants than children are adult recycling workers, who are occupationally exposed to products containing flame retardants. In fact, as you can see by the dotted line, California children have almost the same level of flame retardants in their bodies as adult foam workers, who are exposed to contaminated foam up to 8 hours per day. This is in large part due to an outdated furniture flammability standard imposed in California in the 1970s that led to the widespread use of high levels of flame retardant chemicals in all of our furniture. Graph B to the right shows that children of color and children from low-income communities have the highest levels of flame retardants in their bodies. Some reasons to explain these higher levels may include low-income families may have older products in their homes that contain these harmful chemicals and are in poorer condition and therefore releasing even more of these chemicals as they age. Another reason is poor ventilation, and children may have fewer safer places to play outside, keeping them in contact longer with the contaminated dust. The data we have on some of the most commonly used flame retardants shows the potential for a wide range of negative health effects. For example, flame retardants have been shown to reduce IQ by 5 percentage points, which is on par with the same negative effect on IQ as low levels of lead exposure. As a result, some public health advocates have even begun referring to flame retardants as the new lead. Other health effects include decreased memory, hyperactivity, obesity, altered hormone levels, decreased fertility, decreased birth weight, decreased sperm quality, diabetes, and cancer. A study of flame retardants in childcare settings found that 100% of dust samples collected contained flame retardant chemicals. In over half of the childcare centers studied, UC Berkeley researchers found a cancer-causing flame retardant at levels that they found concerning. Facilities with foam nap mats had significantly higher levels of a cancer-causing flame retardant. The good news is that Gnat mats are not required to contain flame retardant chemicals, and due to years of advocacy and some legal action against those companies who used certain flame retardants, the vast majority of children's gnat mats appear to be free of flame retardant chemicals. In June of 2016, CEH tested 12 gnat mats from a wide variety of companies, and here is the list of those gnat mats that did not contain flame retardants and the 2 gnat mats that did. To protect your staff and children's health, select gnat mats that don't contain flame retardants, and avoid purchasing second-hand gnat mats or those from discounted websites, as these can often be older products that contain these harmful chemicals. Flame retardants are not the only chemicals of concern in gnat mats. You should also prefer gnat mats made without vinyl coverings, which often use harmful additives, and avoid those that contain antimicrobials or are being marketed as having infection control properties. We will cover this group of chemicals later. Below this video, you will find a link to our Safer Gnat Mat fact sheet. This is available for download by going to the link in the bottom right corner of this slide. Children's product manufacturers are not required to label their products as to whether they do or don't contain flame retardant chemicals. CEH wanted to help people find safer products, so in 2016 we surveyed children's product manufacturers and produced a shopping guide that will assist you in identifying flame retardant-free children's products. This guide includes a list of baby product companies as well as the products that they sell, and we have rated them as best, good, fair, or avoid based on company responses to whether their product contains flame retardants and on how transparent they were to CEH and consumers regarding whether or not their products contain flame retardants. This shopping guide is available for download by going to the link at the bottom of this slide. When purchasing children's or adult furniture, you should look for products that have the new TB117 2013 label as shown on the left. This labeling requirement only applies to products sold in the state of California, but the majority of manufacturers that are labeling furniture nationally to this California requirement. This label discloses whether or not the furniture product has flame retardants. It is often on the bottom of the piece of furniture, or for larger pieces, underneath a cushion. Look for products that are labeled with an X, marked on the line indicating that the product does not contain added flame retardants. If you don't see this label, ask a store clerk to help you find the label, and if you still don't see one, we recommend choosing another product that is labeled to this standard. We recommend that you avoid purchasing products that have an outdated TB117 label as shown on the right. We will cover other tips on how to reduce your exposure at the end of this webinar. CEH has developed a tool that can help you identify products that may lead to exposure for you and your staff, and can also help you develop a plan to reduce those exposures. We suggest using this inventory tool to go through the children's products and furniture in your home or center. First, you can record whether the product has foam or polyester. Foam often has flame retardants, while polyester typically does not. You may have to look at the label to determine if your product has foam or polyester filling. Next, see if the product contains a label that says it meets Technical Bulletin 117. If it does, this product is likely to contain flame retardants, and you should make plans to replace it as soon as you are able. If you find a label that says the product meets TB117 2013 and is marked as does not contain flame retardants, that product is okay to keep. If you notice products that are torn and have exposed foam, replace those as soon as possible, since this can increase exposure. We know that it may not be possible or practical to switch out all products that you identify for replacement, but you can use this inventory to help you prioritize and plan for the future. Now I'm going to give the floor back to Alvaro.
Now, we will talk about another unnecessary and potentially harmful chemical that may be found in products in child care centers. Antimicrobials are designed to kill or suppress the growth of bacteria, viruses, or fungi. While reducing the growth of microorganisms may sound like a good thing, there is actually no data to show that these chemicals actually reduce the spread of infection. There are lots of different types of antimicrobial chemicals used in products. Some of you may have heard of triclosan or triclocarban, but there are many others. Antimicrobials can lead to adverse hormone level changes and can contribute to more antibiotic-resistant strains of bacteria, which is a large public health issue. These chemicals enter our bodies through skin absorption or can be ingested. Children who use adult toothpaste containing triclosan may receive higher doses of the compound than adults because they tend to swallow much more toothpaste. Antimicrobials are present in many common consumer products such as clothing and personal care products. In December 2015, healthcare provider Kaiser Permanente announced that they were banning 15 antimicrobial chemicals from use in their facilities. When purchasing products, be sure to read the product packaging and description to ensure it doesn't include chemicals like triclosan or triclocarban, or that the product is being marketed as containing antimicrobials or having infection control properties.
Our third chemical of concern are fluorinated compounds, which are a class of chemicals that are often used as stain or water repellent treatments on the surfaces of consumer products. These are commonly associated with products like nonstick pans, takeout containers, children's bibs, and fabrics. They are made using a powerful chemical bond that makes these treatments extremely strong, but as a result, these chemicals don't break down, and they will be with us for thousands and thousands of years. Like flame retardants, fluorinated chemicals migrate out of the products to which they have been added, and they get into our dust and into our bodies. Children have higher levels of these chemicals due to their frequent contact and ingestion of contaminated dust. These chemicals also wash out of the products and they pollute our water. Some of the most common fluorinated compounds have been associated with kidney and testicular cancer, thyroid disease, high cholesterol, and obesity. While the two most widely used water and stain treatments have been largely phased out of production, the health effects of the new generation of replacement chemicals are not well studied, and emerging studies show that the replacements may also be harmful to our health. So when purchasing products, avoid products that are marketed as stain, oil, or water resistant. The fourth and final chemical that we will discuss is PVC, which is also known as vinyl. PVC is a type of plastic that is present in many different consumer products such as toys, furniture, and the covering of nap mats. Not only are there many health concerns associated with vinyl, but also environmental concerns from how it is made and its disposal. Vinyl uses many additives in the manufacturing process, which are not chemically bound in the vinyl, and can migrate or leach out of the products. Many of these additives have been found to be persistent and bioaccumulative. These additives are finding their way into human breast milk, blood, tissue, as well as household dust as they migrate out of products. PVC is virtually the only plastic that requires phthalate plasticizers, which are known to cause male reproductive abnormalities, and some are known as developmental toxicants. When purchasing products made from plastic, be sure to avoid those made from vinyl, which can often be identified by the number 3 symbol as shown on the slide, especially children's toys. Now I'll hand it back to Isa.
Thanks, Alvaro. After hearing all about the health concerns associated with these chemicals, let's shift and focus on the solutions to protect your health and the health of the children in your care. Many of these tips are very common practices, but it's always good to remember to use them. Because many of these chemicals escape out of the products and get onto surfaces and into our dust, the most effective thing you can do to reduce exposure to these chemicals is by being sure to wash your hands and your children's hands frequently, especially before eating. Another important thing you can do is to reduce dust in your home or center by cleaning areas regularly with a damp cloth or a microfiber cloth to avoid stirring up dust, and regularly using a vacuum fitted with a HEPA filter if possible. Staff who change a vacuum bag should wash their hands after doing so. You should replace products with exposed foam. When cleaning, make sure fresh air is circulating to have good ventilation. Here are some other general tips. To avoid tracking in toxics or pollutants from outside, wipe your shoes using a floor mat before entering a building if possible. Wash your hands after handling dryer lint, which actually collects a lot of chemicals in it. If you see that your nonstick pan's coating is deteriorating, replace it as soon as possible. Avoid greasy foods, as they are usually packaged with paper that contains fluorinated compounds. Never microwave in plastic. It is best to remove food and heat it on a glass container or plate. These tips should be reviewed with new staff and periodically revisited to ensure your staff are practicing and modeling behavior that will reduce exposure to them and the children in their care. Now that we have reviewed the major chemicals of concern and some specific strategies to reduce exposure, here are 5 general tips or strategies to take away from this webinar. First, purchasing matters. Avoid purchasing products that contain the chemicals of concern that we spoke about today. These include flame retardants, antimicrobials, fluorinated compounds, and vinyl. Second, use the product inventory tool in your home or child care center. This tool can be used to help you and your staff prioritize which products are the most likely sources of exposure and should be replaced first. Third, follow the tips to reduce exposure that were mentioned on the previous slide. Fourth, share this information with fellow staff as well as with the parents and families in your community. Because these toxic chemicals are so pervasive in all of our homes and environments, it is vital that we work together, and sharing this information with your community is an important step in the process. Finally, if you have any questions about this webinar, or just generally about how you can help protect yourself and the children that you care for, get in touch with us. Thank you very much for attending this webinar. As a child care provider, you play a key role in ensuring that children begin their early lives in the healthiest environment possible so that they can reach their full potential. Please visit our website for more information and resources. Here is our contact information. You can call or email any of us on the Flame Retardant team, or visit our website at the link on this slide. Once again, we want to thank you and hope that you are able to use what you learned from this webinar in your home, child care center, and community.